formally start the session. So good afternoon, everyone who has joined the session. I can see Dr. Abida, Dr. Noon Shah. Hello, everyone. So I would like to welcome you all on behalf of MedExam. I am Fatma, MRCOG-1 course manager. So today we are going to host the orientation of the progressive course plus a free session in which we will discuss the important things. Okay, so the session is divided into three parts basically. In the first part, we are going to talk about the progressive course because it's an orientation session as well. In the second part, we will talk about the curriculum of MRCOG1. So it's open for all. Anyone can discuss and join on this platform. And we will be talking about the important topics and subtopic that could come in your exam. And the third part will comprise of the recalls practice. Okay, so we will practice a few controversial questions and then we will talk about how to solve these questions in your exam. So before that, I would like to ask everyone that all of you are planning to give exam in January, right? So if you haven't started preparing yet, we have got you covered. Firstly, we have launched this MRCOG-1 Progressive Course. It's a 3 months plan, 2.5 month ideally, okay? So in this, basically, we will have revision-wise bundle, and we will be covering all 14 modules in this. You will also be getting the session recordings of the modules and then the PDFs, okay? Apart from that, you will have separate topic test for the practice of each module, and then you will have a final mock exam. Apart from these things, you will have mini mocks, session recordings, as I have already told you, exam booking assistance. Those who couldn't book your exam yet, you can take help from our team. We will be there to guide you, okay? And you will have a separate study room for Telegram. In addition to that, you will also be a part of the two important workshops, okay? One is the important exam question workshop. So basically, it's a recall-based workshop in which we will discuss 1,000 most important questions that can come in your exam, okay? And the second one is the biostatistics workshop. It is also a live workshop of 5 days, and the dates are 5th till 9th of December. So it's a part of progressive course as well. So here is the schedule, if you can see, and if you need the schedule in detail, you can check your study rooms as well. So with a success rate of 98%, we would like to welcome all of you in our January 25 progressive course. Here are some reviews. You can see Dr. Nalini in July 24, she has cleared with 82%. We have Dr. Saima Rehman and Dr. Ikra Daud and Dr. Ehan. So this is just a glimpse, okay? We have many good reviews like this. So for all the webinar attendees, we have a special discount of 50%. You can avail it through this QR code, okay? So let's formally start the session. Over to you, Dr. Helmy. Thank you.
Thank you so much, Fatima, for this quick introduction about the progressive course. And of course, I'm going to speak in more details about the strategy of the course. So welcome everyone for this free webinar about an introduction or a quick introduction about the progressive course. Also, I'm going to highlight some important topics for studying in general, and also these topics will be covered in our progressive course as well. Of course, they are covered as well in the regular course, but those who are new to MedExam Expert and want to join only the progressive course, they will be provided with this important information. And at the end, I'm going to, test your knowledge by practicing few questions to give you an idea about what we are going to do in our progressive course. So let me share my slides now. I hope everyone is seeing my slides.
Yes, sir.
So yes, okay. Thank you so much, everyone, for joining us to this webinar. And let's start talking by what are the key areas of focus. So our progressive course mainly will be divided into bundles, okay? Each bundle is containing of 2 or 3 subjects, most of them 2 subjects, but one bundle only contains 3 subjects. And there will be a separate days for statistics. As Fatma said, we have a separate statistics workshop that will be, provided for those enrolled in both the regular and progressive courses. So our first bundle will be including physiology and endocrinology. Second one is anatomy and embryology. Third one, microbiology and genetics. Fourth one, pathology, immunology, and biochemistry. And the fifth one is pharmacology and clinical management and statistics workshop. So these are our bundles. Of course, we have a lot of important topics to be discussed or to be covered as a curriculum for the MRCOG Part 1. Of course, in physiology, I'm going to speak, okay, and of course, you can note down the information you want. For the physiology, we depend mainly on knowing what are the physiological changes occurring in pregnancy. This is the main aim of studying physiology in Part 1 MRCOG. Of course, usually in the basic science knowledge, we should relate them to our practice. This is not only a pure basic science, but also we have to relate them to our practice. We have to know what is the applied knowledge of these important concepts. So in physiology, we depend mainly on knowing the physiological changes happening in pregnancy, besides some other important topics like the calcium homeostasis, which is a very important topic. In some books, the calcium homeostasis is written under the biochemistry subject, and some other books write it in under the physiology one. It's not important to which subject it relates, but it's in general a very important topic. Also, we have the interpretation of ABG or arterial blood gases, how to analyze the ABG and how to read an ABG and interpret it. Also, we should know the importance of the urodynamics and how to interpret a urodynamic graph. And of course, in our YouTube channel, we have some free webinars talking about the APG and urodynamics. Of course, this is also provided in our courses, and you can access them as a free sessions on our YouTube channel. Regarding the endocrinology, of course, we have a lot of topics in endocrinology. Endocrinology is a complementary subject to physiology. They are completing each other. In endocrinology, we focus mainly on the reproductive endocrinology, of course, starting from the hypothalamic pituitary gonadal axis, and we will focus on the important pituitary gland hormones, then talking specifically about the ovarian hormones, the steroid hormones, and how these hormones are regulated in the female reproductive system, and what's related to the menstrual ovarian cycle, also the labor, amenorrhea, some other clinical points which are very important in this subject. So this is also for the endocrinology. Beside that, we have some information to provide for the adrenal gland and thyroid gland as well. When we come to anatomy, which is a very major and important subject, specifically in paper 1 of the exam, you can face about more than 25% of the questions about anatomy. So you have to study anatomy very well, starting from the anatomy of the anterior abdominal wall, moving toward the pelvis. And in the pelvis, we have to know the important information regarding the pelvic bones, muscles, ligaments, joints, and also we have to know the genital organs, external and internal genital organs, and also some information about the GIT and urinary tract. We also provide hints about the male breast, the breast and the male genital system as well. So these are important information you have to gather about anatomy. For embryology, we have two divisions of embryology. A general embryology, which focus mainly on the early embryogenesis, the early phases of the development of the embryo. Then some specific point about the spatial embryology, when we talk about the development of spatial organs. And of course, the main organs we have to focus are how the reproductive organs or the genital organs are developed beside the urinary tract, because we know that there is a close relation between the urinary system and the reproductive system. Besides some hints about the respiratory and GIT. And of course, when we talk about the cardiovascular system in embryology, we mainly focus on what we know as the fetal circulation, which can be also covered in physiology or embryology, whatever. This is also a very important topic to know what are the differences between the fetal circulation and the adult circulation, the shunts, and what are the changes happening in the fetal circulation, especially after delivery or after birth. In genetics, of course, you have the basics. You have to know the basics of the DNA, the structure of the DNA, the nucleotides, some genetic problems like deletions, translocations, and so on. How to analyze the pedigrees, which is a very important exam question related to genetics, some genetic disorders. Also, these topics are covered. And of course, genetics and microbiology are the two topics, besides statistics, covered by my dear mentor and friend, Dr. Desiree. She's one of the senior mentors in mid-exam expert. And of course, it's my honor always to share the course with her. So she is pioneer in statistics. And of course, she provide the important information about genetics and microbiology. In microbiology, you have to know the information about the viruses, the important viruses, bacteria, and also some fungi. And of course, there are some clinical topics related to the microbiology, like how to deal with the varicella zoster, how to deal with the chicken pox, and so on. Also, sorry, the GBS, I mean the group beta streptococci beside the varicella zoster or the chicken pox. These are clinical points you have to know for the exam as well. Pathology, immunology, and biochemistry is one bundle also, which will be covered. Pathology include a lot of topics, general one also, like some basic concepts about pathology, like what's meant by inflammation, what happens in inflammation, wound healing, and so on. And beside that, we have the coagulation disorders, everything related to the basic concepts of general pathology. And then we are going to focus on some pathological disorders related to the female reproductive system, like, for example, the endometrial hyperplasia and some other problems. Also, we have the pathology in pregnancy, some disorders which are related to the pregnancy, like preeclampsia, intrahepatic cholestasis of pregnancy, placenta previa and accreta, what's meant by them, and what are the management plans of these problems. So all of that are covered in under pathology. And of course, as I told you, we have to merge between the clinical practice and the basic science. In immunology, we have the general talking about the immune system and what's meant by the immune cells, complement system, immunoglobulins or antibodies. Beside talking about the immunology of pregnancy, this is a very important topic in our practice. How is the baby saved during pregnancy? Why is the maternal immune system not rejecting the baby? What are the immune tolerance systems? What are the changes happening to the immune system of the mother, leading to preserving the pregnancy without rejecting the baby? Okay. Besides some other topics like vaccination, immune deficiency syndromes, hypersensitivity, which is a very important topic. You are going to be asked about examples of hypersensitivity, what are their mechanism of actions, and what are the examples of the different types of hypersensitivity. In biochemistry, also, we have some important topics talking about the carbohydrate, fat, and protein metabolism. Important things about what's the site of glycolysis, where is the oxidative phosphorylation takes place, what's meant by lipolysis, what's the beta oxidation of fatty acids, what are the different structures of proteins, what are the essential and non-essential amino acids, and also some clinical topics related to the biochemistry, like the diabetic ketoacidosis, and also the phenylketonuria in pregnancy. So these are also clinical topics, and all of these topics are covered in our regular course, and of course, they will be revised in our progressive course. Pharmacology is one of the major subjects also as well in paper 2 of the exam, and it includes basic knowledge about some antibiotics, antivirals, antimalarial drugs. Also, we talk about the antihypertensives, drugs related to the uterus, like what are the drugs which stimulate the uterine contraction, and on the other hand, what other drugs which relax the uterus, the anticoagulants, and of course, we have a very important guideline to cover, which is thromboprophylaxis in pregnancy. Also, we talk about the hormonal treatments in the gynecology practice. We talk about the selective estrogen receptor modulator, the contraception, drugs related to lactation. We have a lot of topics in pharmacology, and I need here to also inform you that if you are new to MedExam Expert, if you haven't explored our free groups in the Part 1 MRCOG Guide group, which is our main free Facebook group, I have a post there. I have written all the important topics related to each subject so that you can access and know very well before revising for the exam. And the clinical management, it's not a specific subject. Clinical management is like, the collection of important guidelines, some important clinical information gathered from the different subjects, plus some other, important topics like how to interpret a CTG, how to read a cardiotogography, how to analyze that to know the condition of the baby, how to read an ECG, also some ultrasound pictures, some diagrams, plus the biophysics. We usually merge the biophysics in the clinical management and data interpretation part. We give the important information related to biophysics, which will help you to answer these questions in the exam, because sometimes and for some subjects we need to know what are the tips and tricks of that subject without going in much details, which will waste your time without any benefit, which we call how to be studying in a smart way. Sometimes, or in some important subjects, we need to go in depth of the details, because this will help us to understand things around our practice. And in some other, subjects which are not, firmly related to our practice, we need to just know some superficial information, and just to be targeted to the point of the exam. The last thing is talking about statistics. Statistics include a lot of topics, starting from what's the sample, how to make a sample size, the types of studies, the screening test, the inferential statistics, what's meant by the alpha value and the p-value, okay? What's meant by the confidence interval, the statistical test, how to make a statistical test between two groups, and so on. We have a lot of topics in statistics. And of course, we will, and this is for the first time, by the way, in this batch for January, we decided to make a separate statistics workshop, okay? It will be of few days. Dr. Desiree will be with you for a few days, discussing with you in live sessions and discussing with you in the study rooms. So statistics workshop is a new thing we are going to provide this batch, and I'm sure that you are going to enjoy statistics with Dr. Desiree, because I can guarantee you are going to have a pioneer mentor in statistics, inshallah. So these were just, some information about the revision content and the main important points regarding the syllabus of MRCG Part 1. Course, you will be having a recording of this webinar. So in case you missed some points, you can listen to the recording again. You can note down any important information you want from this webinar, okay? This is our progressive course schedule. And as I told you, we will have 5 bundles beside the statistics, okay? And for each bundle, as you say, you can see here that for each bundle, we have, certain period for that bundle. For example, like bundle 1, which include physiology and endocrinology, will be extending from the 15th of November to 24th of November, okay? So in each bundle, we will have a time to study, and in this time, you will be provided with a schedule, okay? This schedule will help you to manage your time day by day to study like certain topics if every day, like one topic or two topics according to the schedule. At the same time, the moderator of the group, Dr. Swati, will discuss with you the important questions related to that or to these topics. Then after that, we will have a live session, okay? But in the progressive course, the live session is not for discussing details like in the regular course. We are not going to re-explain the theory part or re-explain concepts because you will get access to the recordings of these concepts, all of them. In this live session, we are going to practice questions and highlight some important points and also respond to your queries if you have. Then after the live session, you will get access to a topic test or to a practice test of these subjects so that you can test yourself about your information of these subjects. This will be done for all bundles, okay? The same for every bundle. And the statistics will be separate in a workshop, as you can see in the schedule. And at the end, we will have also another revision workshop, and this is also provided in our progressive course. And let me talk about each point of that. So for each bundle, you will have a study time. As I told you, you will be provided with a schedule which will guide you, okay, to manage your time day by day and know what topics you have to cover by this day. Of course, and I always say that and also in the regular course, I think I have mentioned that the schedule we are providing to you is a guide. It's not like to force you to study thing in that day. It's just a guide for us and you to be on the same page. Like I'm going to ask you a few questions about these topics, and I want to make sure that you cover these topics as well in the same day. But if you have the time and the ability to study more, it's up to you, of course, because some colleagues may have a busy routine, so they can study the subject one time in the time allocated for that subject. Other colleagues may have spare time, they can read one or two times, so they can read extra times in the time allocated for that subject. So it depends according to your effort, according to spare time. So of course, if you have the effort and the time to do more, of course, I'm going to encourage you to do this. But for the discussion to be having a same strategy, all of us, we are going to stick to that schedule when we share questions in our study group. Of course, during this study time, you will be given access to the recorded sessions, whether they are separate recordings of some topics, which we give in the regular course in a phase called the pre-course activities. In the regular course, we have a phase called pre-course activities where we give some recorded sessions about certain topics, or also the recording of the live sessions of the regular course. You will be given access of both. So you will get access of all recorded materials as well as the PDF of these materials so that you can read and study from the recording. So for example, if I'm saying to you that in that day you have to study the interpretation of ABG in physiology in the progressive course, so you will have to open the recording of this topic and read the PDF and study that topic. Then you will wait for the discussion by our moderator. So this is what you are going to do in the recorded session part or the study time part. You have to access the recordings, you have to study from the PDF and discuss with the moderator in the group. Of course, we will have study room on the Telegram. As some of you already joined our course and know that, we will have a study room in Telegram. And in this part, the study time of each bundle, we will make a daily discussion of important topics and previous questions or recall questions, but we are going to make that in a subject-wise way. As you know, the first part of the course, we will have bundles. So when we share questions from the recalls or the previous exam-like questions, we are going to share them like in the subject-wise way. Like, for example, we are going to study the first bundle, physiology and endocrinology. So we are going to share the recalls of physiology and endocrinology. The next bundle, anatomy and embryology. So we are going to share recalls of anatomy and embryology and so on. So this will be your first time to, or the first time in the course to cover the recalls, but divided into subjects. Then, as I told you, after the study time, you will have one live session for each bundle. We will have active participation. We're going to share the questions. I'm going to wait for your answers and study and discuss these answers. If you have any confusion, we are going to clear that. And also, we may highlight some important points like some important tables, algorithms, and such things for the exam. After that, you will get access to an online test to test yourself in these subjects. So this is further practice and more practice for these subjects as well. As I told you, there will be a separate statistics workshop. Dr. Desiree will discuss the important points in the statistics and the theory part. Then also you are going to be provided by questions, discussion, and also an online topic test regarding to statistics subject. And at the end of the progressive course, we will have a revision workshop. This revision workshop, it's like 1 week of a condensed revision. And here we are going to rediscuss the recalls, but in a yearly way, like year by year. So for example, today we are going to discuss 2015 recalls. Of course, we are not going to share all the questions because you will have access to the recalls on our website. You will get access to all the recalls on our website. But here we are going to, like, for the discussion on the group, we are going to select the difficult and the confusing questions because we have a lot of repeated questions. So of course, if you cover one question in 1 year, we are not going to repeat that in another year and so on. But we have to focus on the difficult and confusing questions. And the other questions or the rest of the easy and direct questions, of course, you will get access to these recalls on our website. So, of course, the access to the website and these technical things, you are going to be guided by our technical team, the backend team. If you have any difficulty in accessing any material on our website, just ask them. They are going to guide you. They are going to tell you where are the content of the progressive course, where are the content of the regular course, where are the topic tests, where are the recalls, and so on. Each of these issues or technical issues, they are provided by the technical team, and they are going to help you at any time. Okay. So this is, an overview about the progressive course and what we are going to do for this patch. Also, let me also say something that in this revision workshop, also we are adding something or some new feature that we are going to also have a live meetings with the mentors. Like we know that the revision workshop is the last thing in the course, and also it's just a few days before the exam. So I know this is a stressful time for our colleagues. So just for making you feel reassured and that we are beside you and taking care of you before the exam, you will have, like live meetings with the mentor during this workshop, like 1 hour meeting day by day, every other day, like for example. So this live meeting is just, there will be no certain topics in these live meetings. It's just if you want to ask us any question, if you want to confirm something, if you want just to, like talk about any topic you want, it's just, to relieve you your stress. We are be contacting with you in this revision workshop. Also, if we have any confusing queries or question, we can discuss with each other. So we are going to provide you with the times of these live meetings when we approach this revision workshop. If you are joining any course with the mid-exam, you can talk to the team to tell you about which features you can access through the courses. So I think the team already provided you in the chat box about the contact details, the WhatsApp number and WhatsApp group and everything. You can organize with them which bundle you want to access, or which features you want to access, and they will tell you everything about these issues. So now I have given you an overview about the progressive course, and I'm going to give you some questions now to test your knowledge. We are going to give you a hint about some of the topics we are going to cover in our progressive course. But before I proceed to this part, if you want to ask me about any question about things I have discussed before, of course, I will be happy to answer. Do you have any question regarding the strategy of the progressive course? If anything is not clear, you can ask me. If not, I'm going to proceed for some of the questions. And once I share a question, please reply in the chat box. I'm observing the chat box, and I will give you the right answer and discuss with you the explanation if there is an explanation. Dr. Madiha is asking how much I need to study for the January attempt, like the duration. Okay, this is like an open question. I can't specifically say a certain duration or a certain time, because this depends on two things. First, what is your background knowledge? Okay, and the other thing is what about your daily routine? Okay, but in average, I can say that if you have a focused study for like 2.5 to 3 months, but you have to study like 6 to 7 hours per day, you can go for the exam. Okay, so as I told you, this depends on the background knowledge, and I think most of us, like a lot of information we already know, but it's just like we have to search deeply in our memory to get them back. Okay, and that's the aim of the course, to remind you of the basic concepts. And for the clinical part, I think if you are practicing, this would be easy for you to gather the important points, just to know what are the guidelines and how to follow them. But if you want to, or if you can do a focused study from now till the time of the exam, you can pass the exam, or you can get to cover all the curriculum for the exam. Okay, for another question about clinical management, how I can prepare and the resource, please. Okay, each topic of clinical management has a separate source. All you have to do, if you are not part of the course, in the course, of course, we provide the data and the PDF and everything. But if you are not part of the course now and you want to study by yourself, like I told you, check our free group on the MRCG Part 1 guide. I have written the topics related to the clinical management. All you have to do is to search, or to know the name of the topic, and search for the corresponding source, like a guideline. For example, I say postpartum hemorrhage guideline, so you can read the important points in this guideline. Interpretation of the CTG, we have a guideline, a nice guideline for monitoring the baby during labor. You have to know how to interpret the CTG. ECG, you can have this topic found in essential revision guide book. Okay, and theory books also are shared, or the name of the books are shared in the post. So for each topic, it has a different source. There is no fixed source for clinical management. For now, if you are saying you have 2.5 months left for the exam, do you want to focus on recalls more on, or on modules? Also, if you I can say you have to leave something and go for the other, because this is taking risk. Because now in the current years, or in the most recent years, the percentage of repetition is not fixed. Like before, they were repeating 60 or 70% of the question. Now sometimes they repeat, sometimes they only repeat 30 to 40%. So you have to make a mixture of both. Okay, of course you have to cover the previous questions. This is very important, because this will make you familiar with the exam format and practice. But at the same time, if you are not able to cover all the subjects, you have at least to cover the major subjects, like anatomy, physiology, endocrinology, pharma. Okay, you may go quickly through immunology, go quickly through biochemistry, biophysics. These are very minor subjects. But at least if you don't have the time to cover all subjects and you already booked for the exam, then at least go for the major subjects. Dr. Amber is saying about the exam system. You can skip questions and go back to them. Yes, of course, you can skip questions and go back to them at the end of the exam. It's okay, but just monitor your time. Okay, don't leave a lot of questions and then you realize that the time is finishing. So just put in your mind that you are leaving some questions and you are going to go back for them. Okay. For joining any group, contact the backend team and they will give you the link. Dr. Afsana is saying it's possible to cover workshop and recall solve in regular course. Of course you can do. Just check with the team how can you access them. So these were the questions I have received up till now in the chat box. Do you have any other questions? Okay, so let's move to practicing few questions before ending our session. The first question, this is an interpretation of ABG. So I want your opinion about this ABG, and then we are going to quickly say how we read that. In the ABG interpretation, the examiner is providing you with this table, including the pH level, the carbon dioxide and oxygen, partial pressure, the hydrogen ion concentration. Sometimes they provide it, sometimes not, but of course they are going to provide you with the picarb, the base excess, and O2 saturation. So the first answer I have received, option A, metabolic acidosis acute with hypoxemia. Yes, of course, the right answer is option A. Option A, metabolic acidosis acute with hypoxemia. In this question, as you can see, the pH is 7.15, which means it's an acidic pH. After that, when you have when you know the pH, which is acidic or alkaline, you have to look at two parameters, the carbon dioxide or the bicarb. Okay, you have to check which of them is matching with the pH. We know that carbon dioxide, okay, is acidic, or when it increases, it causes acidosis. When it decreases, it causes alkalosis. And the reverse is in the bicarb. Bicarb is alkalotic. When it increases, it causes alkalosis. When it decreases, it causes acidosis. Okay. And CO2 is the representative of the respiratory system. Bicarb is the representative of the metabolic system. So I have to check which of the changes happening in the carbon dioxide or the bicarb is matching with the pH. So when I have an acidic pH, I will put in my mind, I should have either an elevated carbon dioxide, which cause acidosis, or a decreased bicarb. If I look at the carbon dioxide, it's normal. So there is no problem in the respiratory system. But look at the bicarb. Now the bicarb is very low. The normal range is from 24 to 30, but here the level is 18. And this is also confirmed by a negative base excess, because the base excess or base deficit also is a mirror of the level of the bicarb. So when we have a negative base excess, means we have a low bicarb. When we have a positive base excess, which means we have a high bicarb. So in this condition, we have low bicarb, negative base excess. So the problem is mainly metabolic, not respiratory. So it's metabolic acidosis. And the last thing, look at the O2 saturation or the partial pressure of carbon dioxide. As we can notice, it's low. So by this, we confirm it's a metabolic acidosis acute with hypoxemia. So this is simply how we read or interpret the APG. This is another question. Which one of the following options best describes insulin resistance and lipolysis in pregnancy? Read this question, and before answering, think about what happens in pregnancy. I mean, uh, what is the demands of the baby, and if this is affecting these changes or not. Okay, I know this is a tricky question, but let's think about it. First, what do you think about the main energy store for the pregnant lady, okay, or pregnant mother? Do you think she will depend on fat stores or on just the carbohydrates and glucose level? Do you think she will depend on fat stores, which is, of course, the major store of energy in the human being, or just for the carbohydrates she's taking?
In pregnancy, mainly it's the carbohydrate, which is the main source of energy for both the mother and the fetus. Fat has very minimal, there is no active role of lipolysis or anaerobic lipolysis can help in increasing the blood glucose. So diabetic mother, as it is, there is increased blood sugar levels, so that will not lead to increased lipolysis. So there is per se there is no
No,
change in
he didn't. He
lipolysis.
didn't. He didn't say that the mother is diabetic. Okay, we are just talking about something physiological. I'm talking in general now. Do you think that one can depend only on the carbohydrates as an energy source?
Basically,
You
in
know,
pregnancy,
the large,
car-
the large, the
protein
large,
requirement is
the
mainly
large
it is
caloric depot
carb.
in our body is fat. Okay, the large caloric depot or store in our body is fat. And also don't forget the baby is in need of glucose, okay? So we know that glucose is transported by facilitated diffusion from the mother to the baby. So what happened in pregnancy? Actually, in pregnancy, the mother will not be able to depend entirely on glucose. Why? Because her baby needs that glucose. Okay, so there will be some sort of relative hypoglycemia. Why? Because the glucose is transported to the baby, from the mother to her baby. At the same time, there will be some sort of insulin resistance to help the mother, okay, to depends on the fat store for lipolysis. So in pregnancy, there is insulin resistance and relative hypoglycemia leads to increased lipolysis. This allows the mother to preferentially use the fat like free fatty acids and triglycerides and ketone bodies for energy or fuel, okay, to preserve much of the available glucose and amino acids for the fetus and also to minimize her protein catabolism. This is a change occurring in pregnancy. So in pregnancy, there is some sort of insulin resistance, and due to the relative hypoglycemia, which spare the glucose in the mother's circulation for her baby, so the mother needs to depend on her fat store for providing her with energy. Okay, clear, everyone? Yes, the answer is D. Insulin resistance and the relative hypoglycemia in pregnancy leads to increased lipolysis. Next question. From which of the following structures are the superior parathyroid gland derived? Yes, the correct answer is E, the pouch of the fourth pharyngeal arch. The pouch of the fourth pharyngeal arch. Of course, in embryology, we have two critical tables. One table is showing the derivatives of each of the germ layers, like what are the derivatives of the endoderm, what are the derivatives of the mesoderm, and for the ectoderm, and another table which is the derivatives of the pharyngeal arches, pouches, and clefts. Okay, this figure show you the derivatives of the arches, of the pouches, I mean, and the cleft. And we have another table showing what are the derivatives of the pharyngeal arches. And this is a very important point you have to revise for the exam before going through the exam. Of course, this is a critical part of embryology. And I think this is the majority of the questions of embryology asking you about the origin of the organs, okay? So this is a very important point to consider. A next question, you review a 58-year-old patient in clinic. She asks what the results of her recent DEXA scan are. You note her hip bone mass density T-score is minus 1.4. What is her classification according to the WHO criteria? I don't think she's having severe osteoporosis. The score is not going for severe osteoporosis. Okay, let me show you the answer. Okay. In this case, this woman is having just osteopenia. Osteopenia. The normal bone mass density is up to -1 or 1 standard deviation below the young adult mean. Okay, we have the average mean or the mean of the bone mass density of a certain age group. So the normal of any individual should be around this average, or the lower limit should be 1 standard deviation below this average. Okay. If below 1 standard deviation, but more than 2.5 standard deviation below the young adult mean, this is called osteopenia. Below 2.5 standard deviation is called osteoporosis. If a woman is having a bone mass density of lower than 2.5 from the standard deviation, or lower than 2.5 standard deviation from the mean of the people, and also with a history of fracture, this is called severe osteoporosis. So in this scenario, there is nothing provided in the scenario saying that the patient had a previous history of fracture or anything. And here, bone mass density scan is -1.4, so it's between 1 and 2.5. So it's just osteopenia. So the WHO categorization of the degree of osteoporosis is very important. The next question. A patient with a primary hyperparathyroidism, what will be the correct value of calcium and phosphate? First of all, what's meant by primary hyperparathyroidism? I mean, where is the problem exactly when I say a primary disorder in a certain gland? So the disorder in the gland itself. So primary hyperparathyroidism means the gland is secreting excessive hormone. Okay. So what will be the correct value of calcium and phosphate? Exactly. As you said, it will be increased calcium and decreased phosphate. Parathormone hormone act on a G protein coupled receptor. It's synthesized in the chief cells in the parathyroid gland. This hormone actually has many functions. It increases the bone resorption to increase the calcium level. It increases the phosphate excretion and decrease the calcium excretion at the same time, increase the vitamin D activation. So the net result of the action of this hormone is increasing the level of the serum calcium and decreasing the level of serum phosphate. So the primary hyperparathyroidism will cause increase in the calcium level with a decreased phosphate level. Well done, everyone. Okay, so the midwife has requested the pediatrician to re-examine a female infant prior to discharge from the hospital. She's concerned that the neonate may have ambiguous genitalia. The clitoris is unusually prominent, but there are no other abnormalities on external examination of the genitalia. Of the following associations regarding embryological development, which one is applicable? Is giving you an origin and an organ and tell you which couple of these structures are matching or applicable to each other. Exactly. The correct answer is option A. The genital tubercle is the origin of the clitoris in the female, of course, and it will be the origin of the penis in male. Okay. Other options are totally wrong. We can correct them, by the way. So when I say the germ cells and the extra-embryonic mesenchyme of the yolk sac, so what will be the correct answer? What is the origin of the germ cells? Does anyone know?
Is it extraembryonic coelom which gives rise to the primordial germ cells and primary germ cells?
Excuse me, I couldn't hear your voice clearly. Can you repeat?
Extraembryonic coelom leads to they migrate and leads to the formation of the germ cells. Primordial follicles in the ovary and the follicles.
Yes, yes. The germ cells actually migrate from the yolk sac endoderm, okay, but they
Hmm.
reside in the coelomic mesoderm to make
Hmm.
the gonadal at the gonadal ridges. I mean, to make the gonads at the end. So it comes from the endoderm of the yolk sac, not the mesenchyme or the extraembryonic mesenchyme. Okay. So what about the mesonephros and the kidney? If we want to correct this statement,
It is
it will be.
uh, paramesonephron.
No, no, no.
Kidney is
Mesonephros
better.
will kidney from the metanephros.
Metanephron.
Yes, yes, metanephros.
Metanephron.
Mullerian duct and Gartner cyst.
No. Darkness is a remnant of the Wolffian duct. Oh,
Exactly. So the Gartner cyst is a remnant of the Wolffian duct. And the last sentence will be the reverse, the Wolffian duct and the fallopian tube. So of course it will be the Mullerian duct and the fallopian tube.
and
This is the correction of the last statement. So the origin of the genital organs and also the structures in the female and their homologous in the male are also important to know for embryology. This is one of the clinical questions related to pathology, and here is a 46-year-old woman complaining of menorrhagia. She is diagnosed to have endometrial hyperplasia without a tibia. The risk of her disease progressing to endometrial cancer is. So this question is a clinical management question, is an epidemiology question as well, and pathology question. So it can be, covering many aspects. Yes, the progress to cancer here will be less than 5% over 20 years. So the risk of endometrial hyperplasia without a tibia progression to cancer is less than 5% over 20 years. It will be 1% if a woman is having progression to cancer is 1% in women with simple hyperplasia in general, compared to 3% in women with complex hyperplasia. But in over 20 years, it will be less than 5%. Types of hypersensitivity reaction. Rheumatoid arthritis falls into what type of hypersensitivity reaction? This is an immunology question, of course.
मैं चार्ज हो रहा है कॉल क्यों हो रहा है?
Yes, it's type 3 hypersensitivity. As you can see, this is the table showing the examples of different types of hypersensitivity. So if we look at type 3, we have two very famous examples, the systemic lupus erythematosus and rheumatoid arthritis. So types of hypersensitivity also one of the important points you have to cover before the exam. Next question, which is also one of the clinical questions related to pathology, a 34-year-old woman attending the antenatal clinic for a routine ultrasound scan. The abnormalities of placentation are detected. An MRI scan is organized by the fetal medicine consultant, and the MRI report shows the following statement. Placenta is lower anterior, in which invades through the myometrium down to the uterine serosa. What is the most likely diagnosis? I know the report here might be confusing to some of you. And actually, it was also confusing for me for the first time I saw this question. Why? Because as you know, an expression which means down to the uterine serosa may makes you feel like if it's going like or going through the serosa and extending beyond it, or just reaching the serosa. Okay, so for or at the first instance you might think it's like percreta, as it's maybe like going through the serosa or invading the serosa, so it might be percreta. But actually, according to the most recent green tube guideline published by the Royal College about placenta previa and placenta accreta spectrum in 2000, I think in 2020, I don't remember exactly, but in this guideline they cleared this confusion by showing the definitions simply. If we are talking about placenta accreta, which is the first degree of placenta accreta spectrum, means there is, just adherence of the villi of the placenta to the superficial layers of the myometrium. Like there is a deficiency or deficient decidua, so the placenta is invading through the superficial layers of the myometrium. For the increta, as shown here in this, you know, um, in this definition, in this part, I crop from the guideline increta, where the villi penetrate deeply into the uterine myometrium down to the uterine serosa. But when we want to define percreta, means he will state in the question that the villus tissue clearly perforates through the entire uterine wall and extending to surrounding pelvic organ, and the most commonly, of course, will be the urinary bladder. Okay, so in this question, if the exam just write, if the examiner just writes that it is invading through the myometrium up to the uterine serosa or down to the uterine serosa, means it's increta. If he says that it invades through the entire uterine wall, extending to the bladder or any surrounding tissue, this means it's placenta percreta. Okay? The next question. Capturing, processing, and presenting the antigen to T cells are the only function of which type of cell? This is an immunology question, of course. Okay, so this question is talking about the professional antigen presenting cells. We have three types of professional antigen presenting cells: the macrophages, the P lymphocytes, and the dendritic cells. These are the three major or the three important professional antigen presenting cells. They take the foreign antigens and present them to the T helper cells. The T cells, as I discussed with the colleagues in the regular course, that the T cells cannot detect the soluble antigens going through the circulation. These antigens should be captured by some cells called antigen presenting cells, so that the T cells can detect them. So the antigen presenting cells are like the radar, okay? The radar which detects something for the T cells to be able to detect them and to tag them. And we have three professional antigen presenting cells, which are the macrophages, as I told you, P lymphocytes and dendritic cells. Macrophages and P lymphocytes have other functions in our body, like macrophages are doing phagocytosis and other things in inflammation, while the P lymphocytes are, having the memory P, they can be converted into the memory P cells for the long life immunity in our body, and also they are changed into the plasma cells to produce antibodies. So they have a lot of other functions in our body, but the dendritic cells have only one function, which is antigen presenting. Only this function in our body. They capture the antigens to present them to the T cells. So the answer of this question is E. The dendritic cells are the cells which have this only function, okay? Capturing, processing, and presenting the antigen to T cells. Tissue macrophages and P lymphocytes do the same function, but they have other functions in our body. So dendritic cells is the correct answer. Clear so far, everyone? I hope this is clear. Okay, very good. Next question. For a patient who is severely allergic to penicillin, which drug is advised in GBS prophylaxis? Of course, in the guidelines, we have certain situations where we should give prophylactic antibiotics for the laboring mother to protect her baby against infection by group beta streptococci. Of course, there are some clinical situations. I'm not going to go through them now, but if a woman, and of course, the standard antibiotic is benzyl penicillin, okay? But if the woman is allergic to penicillin, what should I do in such situation? And here, the examiner is saying a patient who is severely allergic to penicillin, not just simple allergy. No, it's a severe allergy to penicillin. Yes, in such situation, I'm not going to give ceftriaxone. We know that if a patient is having just mild allergy to penicillin, we can change that by a cephalosporin, okay, like ceftriaxone, for example. But when we have a severe allergy to penicillin, we know that penicillin and cephalosporins or cephalosporins, whatever the pronunciation is, are of the same family, beta-lactam antibiotics. So there might be some cross-reactivity between them. So a patient who is having severe allergy to penicillin, if you give them a cephalosporin, okay, they might have some allergy as well. So it's better to avoid this category of antibiotics entirely and give another category. So in such case, I'm going to give vancomycin as per the green top guideline. Okay, so in this situation, we're going to give vancomycin. Also, one of the antibiotics which were given before in the old guidelines was the clindamycin. But nowadays, clindamycin is not recommended because the resistance rate against this antibiotic in particular is rising. So they are not giving that antibiotic now to patients for prophylaxis against group beta streptococci. Next question. And this talking about the thromboprophylaxis in pregnancy. So if a woman is taking a therapeutic dose of low molecular weight heparin, when should I stop that before regional anesthesia? Of course, if I'm talking about a therapeutic dose, it should be stopped 24 hours before the regional techniques like epidural or spinal anesthesia. But if the patient is taking a prophylactic dose, which is a lower dose than the therapeutic one, we can stop that just 12 hours before the regional technique. So you have to look very carefully at the exam question. That's one of my advice I always say for my colleagues. In part one exam, the time is very, enough, or you will have enough time in the exam. So don't rush in reading the questions, okay? you have to read carefully. You have to look for the words which will, maybe some change in the words is like a trick by the examiner. So we know that, or I have answered the question many times before, when should the last prophylactic dose? And I always, choose the answer 12 hours. Then the examiner trick me and bring another word, which is therapeutic. So I have to read carefully. Now, I'm having a therapeutic dose, which is a higher dose, so I should stop that 24 hours before the regional technique. But in case of prophylactic dose, which is, as I told you, lower dose than the therapeutic one, so I can stop that just 12 hours before the technique. So regional technique should be done 12 hours after the previous prophylactic dose or 24 hours after the last therapeutic dose of low molecular weight heparin as written in the explanation. This is a primary gravid at 22 weeks. She's scared to have a vaginal delivery because she has female genital mutilation. On examination, she has an absent clitoris but normal labia minora. What type of genital mutilation is that? Of course, we have a separate guideline for the genital mutilation of the female genital mutilation. This is discussed in part 2 in details, of course, part 2 in MRCOG, but in part 1, you just have to know the types of the female genital mutilation. I'm going to discuss that, of course, in the clinical management session in the regular course, and of course, this will be revised in our progressive course. But yes, as many colleagues say, type 1, that's the correct answer. In type 1, there is absent or cut in the clitoris without any cutting or removal of the labia minora. But if there is like a partial or total removal of the clitoris and the labia minora, which include or not including the labia majora, now we are in type 2. So if we enter the labia minora, of course, this is type 2. If we do narrowing of the vaginal orifice or closing of the vaginal orifice and leaving just an opening for the urination and the menstruation, this is called infibulation, and this is type 3. Type 4 is any other harmful procedure like pricking, piercing, or any incision without any medical reason or medical purpose, okay? Of course, we know that female genital mutilation is now prohibited in many countries. Of course, the law in the UK is against female genital mutilation. And of course, there are some, laws and things related to this part. But of course, this is above the curriculum of part 1 MRCG. This is just for for part 2, I mean. But for part 1, just know the WHO classification as mentioned in this table. One of the anatomy question, 26-year-old woman has just given birth and her newborn baby undergoes, sorry, this is a clinical management, I mean, question, undergoes assessment. His body is pink with blue extremities and has a heart rate of 150 beats per minute. He demonstrates gasping, feeble cry, and little flexion on stimulation. What is the most likely Apgar score? One of the clinical management and data interpretation questions, how to interpret the Apgar score. You have to know the scores and how to, sum them and know the final score. Yes, according to the Apgar scoring, this situation will be given score of 6, okay, option C. As the baby is having blue extremities and pink body, which we call acrocyanosis. So here we give him a score of 1. Her heart rate is 150, so more than 100, he will be given score of 2. So 1 plus 2 is 3. He is demonstrating gasping, another 1, so it's 4. Some flexion, another 1, so 5. And feeble cry, so another 1. So the total score will be 6. So the table of Apgar scoring is extremely important as well. The next question, which of the following is the only structure that leaves the pelvis through the lesser sciatic foramen? One of the anatomy questions. Of course, we need to know the structures passing through the greater and the lesser sciatic foramina. So here I'm asking you, what is the only structure that leaves the pelvis through the lesser sciatic foramen? Here, of course, it's the tendon of obturator internus muscle, the tendon of obturator internus muscle, which is extending from the pelvis to be inserted to the greater trochanter of the femur. So these are the structures passing through the lesser sciatic foramen, the tendon of obturator internus muscle, the nerve to obturator internus, pudendal nerve, and the internal pudendal vessels. The angle of the vagina with the horizontal plane while standing equals to Yes, the correct option is A, 45 degrees. I know some colleagues may get confused between 45 and 60. Let me tell you, when he asked about the axis of the vagina in corresponding to the horizontal plane, the angle will be 45. But if he is asking you about the axis of the pelvic inlet, in relation to the horizontal line, here will be 60 degree. Actually, it is 50 to 60. Okay, it's a range. In some sources, they say 50. In some sources, they say 60. In other sources, they say the average, which is 55. Anyway, the examiner won't bring the three numbers in the same option, okay? So he will bring either 60 or 50 or 55, but this is if we are asking about the pelvic inlet. But if you are asking about the vagina, so it's 45. So the vaginal pH is acidic between 4 and 5, and it's having a 45-degree angle in relation to the horizontal plane and a 90-degree angle in relation to the uterus. A 28-year-old primiparous woman attending her booking appointment at 10 weeks of gestation, she's keen to maintain a healthy diet during her pregnancy and asks her midwife to explain the difference between essential and non-essential amino acids. Of course, essential amino acid mean these are amino acids which are not provided by or not made by our own body. It should be provided by meals, okay, or by food. So which of the following is a non-essential amino acid? Of course, the correct option is option E. It's the tyrosine. These are the essential amino acids, which include histidine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan, and valine. So these are the essential amino acid. Of course, they do not include the tyrosine. So tyrosine is a non-essential amino acid. In which part of the cell does glycolysis take place? Yes, for the glucose metabolism, we have many steps. We start, especially when we are talking about the aerobic metabolism. So it starts with glycolysis, okay, which occurs in the cytoplasm of the cell or the cytosol. Then we have two steps which are occurring in the mitochondria. They are the Krebs cycle or the tricyclic acid cycle, as well as the oxidative phosphorylation, or what we know as the electron transport chain. So the answer here is A, cytosol. This is where the glycolysis takes place. After that, the products of glycolysis, which is the pyruvate, undergo oxidation to acetyl-CoA. Acetyl-CoA will enter the Krebs cycle in the mitochondria, and the product of the Krebs cycle will also enter another step called the electron transport chain, where most of the energy is produced. In the other type of metabolism, which is the anaerobic one, the pyruvate will be converted after glycolysis also in the cytosol. Pyruvate will be converted into lactate or the lactic acid, and then the lactic acid will be transformed again into glucose or produce glucose by another cycle called Cory's cycle. Cory's cycle. So by this, I think we come to the end of just quick free webinar. We have made a quick introduction about our new progressive course, which we are launching in November, inshallah. We already have some colleagues who joined us, and they are now having access to our materials. If anyone want to join us in the progressive course, also you can contact now the backend team. And these are some the examples of questions we are practicing, and we are going to practice more and more in our progressive course. I hope you enjoyed this quick free webinar, and also if you have any more questions, I can answer inshallah before ending this session. Thank you so much, Dr. Amber. Thank you. Thanks, Dr. Yuki. Thank you. My pleasure, everyone. And thank you all for joining the webinar. It was my pleasure. Thank you. You are welcome. Thank you. Okay. Once again, thank you so much, everyone, for the attendance and for the nice discussion. As I told you, for any links, for any access to our materials, just our backend team have put the links in the chat box. You can have you have a link to WhatsApp number, and also you have a link of our pages, and so whether on the Telegram, on Facebook, you can access the team by many means. Okay, they will let you know what are the services we are providing. You can pick up the service which is suitable for you and which will help you in the upcoming months before the exam, if you are, of course, having or booked for the January exam. Also, if you have any medical question also and you want to reach the mentors, we are available in our free groups, and also you can send whatever you want to the backend team and they contact us and we can reply also to you. Okay, so once again, thank you so much, everyone, and I wish you all the best of luck in preparing for the exam and also during the exam, inshallah. And we are looking for to having you with us in this journey until you got the MRCG degree. By the way, uh, something which really made me very happy in the past couple of days that I was making the MRCG Part 3 circuit course, which is one of the official courses held by the Royal College. Okay, and of course I was invited as a clinical examiner there, and there I met some of my colleagues who were taking with me Part 1 and also have finished Part 2 with mid exam expert, and they came for the official course for the Royal College because this course is a simulation before the exam here in Egypt. Of course, they have booked in Egypt, so they came to have a mock exam before the real exam. So I was very happy when they told me that they were with us in mid exam expert, and now, mashallah, they are approaching Part 3 and they are just one step of being members of the Royal College. So inshallah, I hope all of you pass Part 1 and then Part 2, and I meet you inshallah in MRCG Part 3 courses and exams. This is a very interesting journey, and of course you are going to learn a lot from going through the MRCG's curriculum. This will change your mind, change your way of thinking, and I am sure you will be a better doctor of going through the guidelines and know how to practice with your patient. Thank you so much, everyone. See you in more free webinars. And of course, I will meet you soon, my colleagues who are in the regular course, in pathology session, and also in the first session of progressive course. See you. Bye-bye.